Diagnosing abdominal pain in young children can be a dilemma. The main reason being that abdominal pain, especially in girls, can be of different causes. It can be intestinal as well as it can be renal, or it can just be associated with menarche. The main differential diagnosis, if somebody comes with the right side abdominal pain, is to differentiate between pyelonephritis or a urinary tract infection and appendicitis. Today, I have a young girl who's 17 years old who developed abdominal pain with fever about 3 weeks ago. She was initially given a course of antibiotics, no investigations were done, and the fever settled. 2 weeks afterwards, she developed similar abdominal pain, which was more on the right side and on the front, not radiating towards the back, and the pain was getting worse when the patient lifted the right leg. This was not associated with increased frequency of urine, although she did complain of dysuria. Her urinary frequency wasn't increased. In fact, she hasn't passed any urine for about 8 hours this morning, which means that she does not have any bladder irritability. On examination, found that the focus of pain was indeed here, which is the right iliac fossa, and there is no tenderness at the back. She is apyrexial, her bowel sounds are normal. And once again, when she lifts her right leg, she feels pain in the lower part of her abdomen. Her urine examination is practically clear, and I'm still awaiting an ultrasound and a CBC test. So this young girl has, in fact, symptoms of acute appendicitis and not a urinary tract infection. The differentiating feature is the absence of dysuria and the absence of increased frequency of urine. Had there been urinary tract infection, she would have had probably a pain in the hypogastric region, along with pain radiating on both sides of the abdomen upwards, and along with increased urinary frequency. The patient often has to go to the urine to pass, or often has to go to the toilet to pass urine every about 15 minutes to half an hour to maximum 1 hour, which is not the case with her. So I'm going to do a full blood count and request an abdominal ultrasound just to make sure that I'm not dealing with an acute appendicitis. Thank you.